Hi, my name is Dr. Taylor Van Wyman. We're going to go over different reasons why your lab results will come back as normal, but you still have symptoms of decreased thyroid. So, number one, we're going to go over high cortisol. Now, these don't go any particular number. It's just kind of random as far as that goes. So, what is cortisol? Cortisol is an adrenal hormone. Symptoms and signs that you might have high cortisol would be things like back pain, headache, poor sleep, tired even though you got a full night's sleep, weight gain typically around the midsection, you get sick easily, you crave unhealthy foods, decreased sex drive, digestive issues, you're anxious, and you're depressed. The reason you're depressed is because high cortisol actually decreases your serotonin levels, and we'll get into how that works and why that affects the thyroid in just a second here. So as far as all this stuff goes, the way to find out if you really have high cortisol levels is proper testing. And proper testing for all the things that are included in this. So don't expect your medical doctor or your endocrinologist to do this testing. We use functional medicine, which means we're looking for the underlying cause of disease, and that's why we look at these different aspects. So high cortisol giving low thyroid function. So just a little refresher, what you have is you have the hypothalamus, which is in the brain, releases thyrotropin releasing hormone, which goes to the pituitary. The pituitary then releases thyroid stimulating hormone. Now these are both brain hormones. They are not thyroid hormones. So what you need for this axis to properly work is you need proper dopamine, but you also need proper serotonin levels. So if high cortisol depresses or suppresses serotonin, that's the number one reason why you can have an issue of high cortisol causing low thyroid. There's another issue that plays into it too that we'll get into a second here. So what you have is pituitary releases TSH that goes to the thyroid gland. So what cortisol also does is it decreases pituitary function. The way it does that is a feedback loop with the cortisol and the pituitary itself, because the way the adrenal gland works is it also sends a signal to the pituitary to release specific hormones, but that's also where TSH is released from, and that's how it affects it. So in a properly functioning system, you have the hypothalamus telling the pituitary that it needs to release TSH to go to the thyroid. The thyroid will do is it will release T3 and T4. T3 is the active form of the hormone. T4 is the inactive form of the hormone. So what your body does, your thyroid gland, it releases 7% T3, 93% T4. Now that's important to keep in mind here. So what the two hormones do from that point is your T4 and your T3 jump on a little taxi cab called thyroid binding globulin. Thyroid binding globulin takes T3 and T4 to different places in the body. So it takes T3 to the cells so it can enter and do what it's supposed to do. It takes T4 to the gut and to the liver to be converted into T3. So you take that 93% of T4 to liver and the gut, and it's converted into T3. The problem is, and this will be your third reason why high cortisol will give you symptoms of low thyroid, is it stops the enzyme needed to convert T4 to T3. The enzyme is called 5' deiodinase. So if you're decreasing the enzyme needed to convert T4 to T3, you're going to have a conversion issue, which is going to give you symptoms of decreased thyroid. Now, where serotonin plays into this is serotonin is one of the cofactors needed for 5-deiodinase to work properly. So if you have decreased enzyme function because of high cortisol, but you also have decreased serotonin, which is a cofactor for the enzyme, you're going to have vastly decreased conversion from T4 to T3. So the last reason why high cortisol will give you symptoms of low thyroid is when that T3, like say, jumps on the thyroid binding globulin and goes into the cell. T3 readily crosses the cell barrier, goes to the nucleus to turn on different genes to create proteins. So what happens to T3 is it's actually blocked. The receptors for T3 on the cell, high cortisol will actually block those receptors. It won't allow the T3 to get across this cell barrier to do what it's supposed to do. So what will happen is it'll give you symptoms of thyroid resistance. So all these things are due to an adrenal hormone, high cortisol, causing symptoms of decreased thyroid. So what are some things that can stress your adrenal gland to increase cortisol? Things like anemia, poor blood sugars, hidden infections, food sensitivities, poor sleep, emotional stress. That's probably the most obvious one, but So that's why you really need to get to the underlying cause of why you have the issue. And that's why we use functional medicine to do that. Like I said, don't expect your medical doctor or your endocrinologist to do this testing to see what the underlying cause is. That's what we do. So you need to get to that underlying cause so you can actually heal the person. So we're going to continue to come out with these. There's lots of different reasons why you have symptoms of decreased thyroid. This is just one of them, high cortisol. So stay with us, and we'll be looking forward to more videos soon.